talking and start with the I'll just start with the basics. The first basic thing is whenever Australia is a kind of country where most of the people, I think it's one of those essential things, definitely, to pass an exam, and passing step one, AMC, MCQ, and AMC clinical is important. People, as Dr. Brahma said earlier, that most of the candidates used to secure a job after doing their AMC, MCQ exam earlier. But in recent years, the as the current, I would say, job substantiality has reached its peak. So, and the hospital systems are getting much more busy. They are trying to get more trained, qualified physicians to settle at the jobs, which can take more responsibilities. They can take more hands-on while they are at their job, and who can also perform better during high-pressure environments, or when they are assessing patients, or when they are trying to work their way out. Because sometimes if it gets busy, they want a person who can handle the stress as well, who can handle the patient load, can also do judgment at that particular point and make sure that things get done. But yeah, that's one of those things. That's why the job market at this moment is looking for people who usually do AMC clinical. But there are definitely ways around to that as well. Definitely there are ways around to that. Okay. Second thing is the second main thing which I always tell whoever I speak to is, please apply wide and broad. Okay. Australia is also a kind of a job market, not only in medical profession, in every other profession, where best chances of getting a job is when you apply wide and broad. Okay. Just a simple saying, to increase your proportionality of getting a job. Okay. Apply wide and broad, because it's important to get into the job market and then making way towards your career. Okay. Third thing is having a good CV. Okay. Having a good readable CV. Having a good CV doesn't mean like a person who, for example, if a person who's quite young, has recently passed their exams, has done a good amount of training as well during internship, has done researches, sometimes might not get a job because the CV is not readable. Okay. Or the CV is not goable. Okay. Whenever a recruiter goes through a job profile or number of candidates, they look at the CV for maximum 2 minutes. And that's it. They try to pick up maximum points in those CV and then move on to the next candidate. Okay, so your CV should be readable. Try to do as many CPD courses as possible, so that you can show there is a continuous point of learning. There is a continuous push for learning. That's what some of those hospitals like. Okay. There should be continuous push for learning. There should be some, if you can do some research, you can put things on, can put some extracurricular activities. You should be a good team player, so you can add those things on as well. If someone played cricket, has been a good team player, please put it on, that I've been a good team player. Okay, so these are the things they want. They want a very comfortable, jolly, very good, easygoing person at their job. Okay, so these are the things which I would say in a nutshell, these are the main things which are required in a particular job. Okay, yeah, yes, Vishal.
All right. Thank you so much, Dr. Karan. It was a pleasure. We had opportunity to meet him after 6 years, and as he's already said, he's serving in a senior reg internal medicine position now. And I've met him at a point where he was doing MCQs, then clinical course, and then at a job hunt as well. So those were the few things we would always recommend everyone. If you do a course, not a course, do a workshop or not, but CPD points are really important for you to give that sort of exposure. And Dr. Karan, coming from my end and coming from your end would be really different. You've been through their shoes, and you've been through all the, you've been to that side where you were preparing, and now you're on the other side where you've done everything. What's one thing that kept you positive? And, there are students who are like, oh, we've got a big gap, we won't make it. Or if someone's from different part of the world, they've not got internship, or a lot of people might take a break, the girls might take a break, and you're at a quite senior position. You've seen junior doctors working with you. What would you recommend in that? And what's something that could keep us still positive and, keep applying? And what's one thing that you'd quote here just to fill up this gap?
Well, I think, well, first of all, guys, I'll be very honest. I think we are all doctors. We are actually the 1% of the population of the world. So we are trying to compete among ourselves. So if one person is trying to compete among ourselves, then definitely there will be some failures. There will be some setbacks. Please don't take them onto yourself. There are sometimes chances people apply for like multiple jobs, and after like so many rejection, they get this one particular chance, and you just need that one chance and need to secure that job. That's it. To secure that job, interviewing skills should be good. Okay, that's one of those things which I would say. And I remember when I was doing my interview, Kush actually prepared me for uh, prepared me for that interview. So, and these days I do take interns interviews as well. So I do remember all that. So
I think
yeah,
I need
so
to learn now.
yeah.
Hmm.
Yeah. Yes. So Kush did prepare me for that. So I think rejection is basically part of our career. We'll get rejected. We are trying to compete among ourselves, that top 1%. And on top of that, I think that's why I said please apply broad and wide in different states, different hospitals. Um, because there are better chances of getting jobs into sometimes into those kind of states which are sparsely populated, but they need doctors at those particular areas. And on top of that, I think it's just inbuilt thing that if we are applying for a job, please be ready for a rejection, but please don't take it on your heart. Whenever you get a rejection, get a feedback from them. Please send them a nice email. Hi, thank you very much for considering my application. Can you please send me a feedback? What are the things I should be getting better at? What are the things I should be mentioning in my CV? What was the things which you considered in the applicant who actually got successful in this particular job? And I would say 7 out of 10 emails which you will send, if you get any rejection, you will at least get a reply in, I think, at least 6 of them. And those will be very, I would say, very structured, processed, and very, I would say, experienced replies from people who basically go through every CV, they file them up, and then they have their own point system. So they will be able to tell you where were the person, where was the CV lacking in points, and or where was the interview lacking in points. So please do send them an email and get their feedback. It's quite important. I will be very honest. Everyone gets rejection in their life. I myself got rejections. I used to send them an email. I even went out into an office and asked them, where did I missed in my interview? Can you please tell me about that? That was actually my physician training interview, and it was at the same place in this particular in a particular hospital. And I actually cracked that interview 3 months after I failed that interview. So yeah, so I think getting a feedback is quite important. And in your feedback, they basically tell you this is a kind of a thing which we are looking into a candidate. So it's quite important to get a feedback. But yeah, but the other thing which can basically give an edge is if you are applying, for example, if someone is applying, most of you guys will be applying for a level 1 JMO position in which you'll be given level 1 supervision for most of the jobs. It's always recommended, please go through the job description inside out. Half of the interview is based on job description. If you know what's written in the JD, there are chances that you will be able to answer 60 to 70% of questions without even reading about them.
A lot of questions that I get, it's really laborious to apply jobs, 20 jobs a day, and we get 20 rejections. Should we alter each and every resume and each and every cover letter as per the job? And oh, can it be done by someone else? And I always say, see, this is normal. Yes, it is. It's the first job that you need. From the first CV, you need the first job, I guess. And from the first job, it's the first interview that we need to crack. Once you step down into the system, it's going to be easier. So, am I right here, Karan and Dr. Brahma?
Yes, yeah, I would say so. Yes, I think as I again said, and Dr. Brahma, I believe he will agree with it. Rejection is part of the thing, so
Yeah.
please don't panic about it, and please don't get disheartened about that. And I think trailing your CV 10 to 20% is always recommended whenever
Yeah.
you apply for a job. And
Right.
please be careful. Don't write if I'm applying for Northern. Please don't apply. Please consider my application for Eastern Health. Please
Yes.
write it down as Northern Health. I have seen applications where interns apply for a regional hospital and the CV comes to me. And one of my seniors is like, can you go through this CV, please? And I'm like, okay, this person has applied for multiple
Yes.
places,
Yeah.
which is
Yeah,
totally fine.
definitely.
They don't mind it, but it
Yeah.
usually gives out an impression, oh, the person is haven't
Right.
got the eyes open. so,
Yeah.
so
Yeah.
please be
Right.
careful with
Yeah, it they get, I know it's very frustrating even, for
it.
me,
It
I
is frustrating.
understand that, yeah. And because you go to the website again, you're entering first name, last name, email address, phone number, da da da, address, and they're like, should we write the Australian address? Should we write the Indian address? Should we write more of Australian exposure? I say yes. If you've taught anywhere, please write it down. If you've done research, please write it down. Teaching is really important. They love the doctors that they'll teach the junior staff as well. So that's really important. In interviews as well, when they're asking, tell us more about you, they don't want to know that I've done MBBS from here, I've done my master's from here. I think they want to know that how sort of you'll answer that, yes, I've already outlined my qualifications. And then I think they want to know as if a person's perspective as well, like just Karan said, that they want a easygoing who'll be adjusting in the environment because they're going to throw you under the bush. I know it's been busy in the offices, and then they don't want to handle another person who's come with, oh my God. So I think that's what the feeling is. With 10 years of me dealing with other doctors and them all getting into jobs, I can see the most happiest ones getting it. I don't know, I'm saying the wrong things as well here, but there they are. There are two people sitting here. You can ask them to comment more on the interviews, CVs. But guys, I would always say if you've got a gap, if you've done some community work, you're giving back the values, giving back to the community. These are really few things that I really want to listen to. Giving back to the community, the support, the values, and all of these things are really important to involve in your I think interviews, your resume, your cover letter, and all of that, right, Karan?
Yeah.
Yeah.
I would like to add on one thing, as Kush suggested about a gap year. So I would say that please be careful with your gap year. For example, due to some reason, someone gets into a gap year, please make sure that you are able to cover that. That would be in a sense, please continue doing your CBD points. Please continue doing ALS and BLS because they are actually the most important ones. You should be able to recognize a MET call. If there is an unstable patient with a heart rate of 130, blood pressure of 80 by 40, you should be able to recognize that. So please do your ALS and BLS regularly. Please do your CPD points. Please be prepared. Like even if you want to do a graduate certificate of research, you want to do master's somewhere, you want to do something else, please be prepared to cover it up. Okay. And you can even put the MCQ course in the thing as well. Like I was preparing for it. That's also helpful. That they will consider that you have done something in that gap year as well. A person was not totally away from learning or clinical practice. So please be prepared for that. But please don't be scared of getting a. I wouldn't recommend a gap year, but just in case due to a reason someone has gotten into a gap year, please don't be scared of that. Still apply for jobs, still do things. Don't consider that as a weakening point in the CV. Sometimes if a person does something really important in a gap year, for example, if someone has continued their clinical learning, their observerships, someone has done, for example, like a couple of GP centers observerships, some hospital observerships, please put that in your CV as well. Even if that's overseas, even if you have worked or shadowed someone, if that person is able to provide you a letter, more than enough, they will consider that as well. Hospitals do consider that as well. So please show them as much as I would say evidence to cover that gap year as well. Please don't think that, if someone's got a gap year, for example, like 2 years or 3 years, they will not consider it a CV. They do look at it, but there are more important things uh, as compared to a gap year, which they look into. Okay, that's what I would say.
I think that was quite extensive. Thank you so much, Dr. Karandeep, being on board. I'll try to organize another one-on-one sort of an interview with the Zoom link, and then we might do a more extensive one where we've got a few people who are asking a lot of questions, and then we can discuss that more. Thank you for coming on board today, and it was a pleasure that you came back, and really proud of you. Where yeah. And I've seen another transformation of his as well. I don't want to share it all across here, but we're really proud about that as well.
I would say thank you very much for that,
Yeah, thank you.
Alan, as well. I would say like it's a person's growth is usually my take-home message would be from this particular thing is a person's growth and achievement is not always an individual's achievement or growth. It's basically the support system, the peers, colleagues, guidance, tutors, and everyone else who actually supports the person up to reach a particular point. So I would say, please always be thankful to them, stay in touch, and I kind of missed into it, but please stay in touch, and please try to get as much guidance as possible. Try to reach people on LinkedIn. Try to find people at different hospitals. Whoever you can reach in, whoever you can get a single word of guidance, even though people are repeating the same thing again and again and again, please get the value of those words and make sure you do those things as well, and try to reach as many as people as possible, and try to just know how to sell yourself. That's what the take home message would be. Get as much support as you can from people around you. Okay, I think in this world of internet, we are actually quite connected with people. Person should just be able to get support.
Well said. Thank you so much. Thank you. We appreciate the valuable knowledge that and the take home message. I think I completely agree on it, and I want to inculcate it more. This is what I've learned today from you. That was really amazing. Thank you, Dr. Karan.
Welcome.
All right.
Pleasure. Have a good day, everyone.
You too. It's going to be a long weekend. Yes.
Thank you, Dr.
Now,
Karan. Thank you for your insights and things. Really
Pleasure.
appreciate, and all the best for your future. Thank you.
Thank you. Thank you very much, Dr. Ron.
Cheers.
Good luck, everyone.
Right. Thank you.
so we've got Dr. Brahma here. That's our amazing doctor as well. One of our star tutors in our courses, quite in high demand as well. Really well known all across a lot in Australia, and I think all across in the world as well. And we really
Okay.
appreciate you taking out the time and being with us, Dr. Brahma.
No, you're right.
And the candidates love you after passing as well. We get long notes of you that we remember Dr. Brahma there. So the moment they get a question and there's an answer, it was Brahma. It was because of Brahma I was able to answer it straight away.
It's all
Thank
cumulative
you so
effort from
much.
everyone.
Yeah.
Yeah.
Thank you,
Cumulative
Dr.
effort.
Brahma, for being
Yes.
here and taking out all the time. I know you're very busy with the family commitments as well, but still, we'd like to thank you joining us.
Yeah.
And so I was about to talk about few things as well, but I will leave my part later. We'll come to the to your part. So with Epic and all and AMC, I will give them a short list of that if someone wants to know about it. So would you mind?
Yeah. Alan, do you want to say something before we begin, or are you happy?
Yeah, sure. Yeah, I can.
Yeah.
Brahma, thank you.
Cheers.
And thanks for the Karandeep who just spoke, and thank you, Dr. Brahma. Thanks,
Yeah,
Kush,
thank you.
for organizing this. So I think I was a referee for Dr. Karandeep when he got his first position. So again, just to let you know, for those that don't know me, I'm Alan, and I've been doing these courses for a long time, but also I've worked 10 years with local medical students too. So I've had experience in both. But I don't want to do this like as a promotion for Aram Gas. I want it to be just something where I can give you some help in trying to get you into the workforce as soon as possible. So what I'm going to talk about is your the things that you need when you're doing referee reports. Like I'm getting requests all the time to do referee reports. I think this week I've had maybe 5 or 6 referee reports that I've had to do for different doctors that are applying for jobs. And those referee reports, I can either be contacted pre-interview or post-interview. Depends on the hospital. If they want to, if they interview you first, they might follow up with a referee report that I need to do, or they might send out referee reports before the interview, when they're shortlisting who they want to interview. So that could be done at any time. And the sort of things that they're really well, first of all, before I talk about the sort of things that they're looking for, it's really important for you to have referees, and they need to be referees that know you well, and because a referee can be someone who's really supportive of you getting a position in a hospital, but it can be a disaster if you've chosen the wrong referee. And I can give many examples of that, but I won't go on about it now. But I know many people who've chosen the wrong referee. And if the problem is, if you've chosen the wrong referee, it's very hard to know who that referee is that's not being supportive of you, because everything's confidential. And if you've chosen the wrong referee, then it can be a disaster, and it can lead to not getting any job offers for a long time until you find out who that person is. So again, if you're looking for a job in Australia, it's important to have some referees from Australia. And I know that's hard if you haven't worked here, but I'm telling you what the basic requirement is. And I would say that if you're, say, a doctor from a particular country, then I think you could get away with having 2 referees from that country, but you would need to have 2 referees from here. Usually, if they're looking to employ you, they'll contact at least 2 of the referees. And I find that more often not, it'll be the 2 referees that are here in the country that you're inquiring for the job, to get the job. So I think that that's a basic requirement. And then you have to be a bit creative. You have to find out who can I mean, again, I said I don't want this to be a promotion about Aram Gas, but if someone hasn't done a course with me, then I would probably refuse to be a referee for them, because for me to be a referee for someone, it needs to be someone that I know, that I'm confident about doing a referee report for. Because if I'm doing a referee report to the hospital and it doesn't turn out well, then it affects my reputation as well. So I take it very, very seriously being a referee for someone. So I think that, and the sort of things that they're looking for when they're doing a referee report, you can see, Akil, could you put one of the referee reports up for me? This is one that's one that I've done today. So you can see that they've asked me, how long have I known the applicant? So, and that will be, this is a standard referee report. So this would be for if you're applying for a job. So if someone's, say, done a 7-day course with me, it's not enough. How long have I known the applicant? If I put down 7 days, it's going to be counterproductive. So for someone, so I need to know them quite well. So that means that they need to have done at least, a course that's going for 1, 2 months, 3 months with us. So we get to know them. And then the sort of question that I ask, what capacity? Well, then in my case, I would have to say a bridging program, for example, or something similar to that, or workshops, bridging program and workshops, and how well do you know the applicant? Well, then I would have to say something like, I'm a supervisor for that particular person. And then they're asking about what sort of skills has the person got? What sort of professional? So again, if someone's done a bridging program where it's just the MCQ, sometimes I might find it difficult to answer some of these questions because they'll be talking about their clinical skills. But sometimes they're not that, they just want to know what sort of person you are. So if someone's done just an MCQ course, they might ask me things like, what was this person, did this person cause you any problems when they did their program? No, that's fine. Did they get on well with the other people in their course? Yes, they did. Yeah, they got on well. What's their communication skills like? And then they might ask some sort of basic personal questions like that. And then if they get a positive response like that, then they might say, thank you very much. We'll sort the medical stuff out in the interview. So that might be just enough. But more often than not, if someone's done a clinical course, Akil, if you can go to the next one, then they'll ask me questions like this, the sort of go back again, Akil. Yeah. Does the applicant contribute positively to the workplace environment for the colleagues? Does the applicant contribute positively to the team environment? They're all the basic. Then we go down, then they might ask you if you've any issues with whether you've been had any negative things happen that they want to know about. Does the applicant respectively make suggestions to improve the practice or the processes? Does the applicant take on challenges to handle? So they're all quite difficult questions that you need to answer. So you need to be someone that knows that person very well. Okay, the other thing that I would always mention if I'm doing a referee report is CPDs, which I noticed Karandeep talked about before. So when people do our programs, they get CPDs. So I would always mention down the bottom, this is so many CPDs. It shows that you're keeping up to date with your medical education. And it's always quite powerful when usually I'll mention that at the end of the referee report. This person has done so many CPDs for the bridging program and the workshops that they've done. I think, again, what I mentioned before about having to know you, like I had a girl asked me today could I recommend her for a position, for a GP position, which I can do because we have, like I've been doing this for a long time and I have many, many doctors that own their own clinics now. And I'm quite often getting contacted by general practices asking me to recommend some people for these positions. But this girl has got a very impressive CV, but it passed MCQ and she's got the required amount of general practice experience, but asking me to recommend, but I can't recommend someone that I don't know. So that's, again, I've just had to say, look, I'm sorry, I can't recommend you because I need someone that's done a program that I know quite well before I'm happy to recommend. So I think that I don't know if any people have got any questions on, again, something that Karandeep mentioned. Again, if you've done any observerships, I mean, anyone who's done one of our programs, they do observership with us. We have a Mr. Guy, who's a surgeon who allows people to do observerships with him. And anyone that does an observership, we get them to write up what they've done in the observership. And then we usually get Mr. Guy to sign it at the bottom, and then we give you the opportunity to attach that to your CV. But there are many other observerships that are, Northern Hospital has observership, Werribee Mercy Hospital has observership, Austin Hospital has observership, Mildura Base Hospital has observerships. And there are many, a number of hospitals in Queensland now are offering observerships. So any of these observerships are excellent things to put onto your CV. And I would always say, if you do one of these observerships, I would apply for jobs while I'm doing that observership. And in my cover letter, I would put down, I'm currently doing an observership at Northern Hospital, and I would like to apply for a position at this particular hospital. I think all of those little things like that can be powerful when you're looking for a job. Okay, I don't want to go on too much more, but I just wanted to give you a brief outline of how I experience it when I'm looking for a job. And I think I'd like to refer back to you now, Dr. Brahma, to talk about anyone got any questions they'd like to ask me now about applying for jobs?
Sorry to interrupt, Alan. I will continue that section. Let Dr. Brahma talk
At
about
the end, so let
self-care.
Dr. Brahma do
Yeah.
his talk.
Right.
Yeah.
All right.
Yeah, and
Thank you.
I'll again continue. I'll come back to that point because I've got a few things to add on as well. So
All right then.
yeah.
Right.
All right then. Thank you, Dr.
Thank
Brahma.
you.
Thanks,
Right. Thank you.
Kush.
Thank you, Alan. Thank you for your insights. Right. Again, afternoon, everyone. I believe most of you know me. For someone who don't know me, and if you have coming from outside and have enrolled for this session, so I'll just briefly introduce myself. So my name is Brahma, as you can see. I'm one of the tutors at Alan's Institute. I've been teaching there since probably this would be my fourth year and jumping into the teaching. So briefly about my background. So I did my med school in India, and I was initially preparing for USMLE stuff, and then due to some commitments and the COVID stuff, eventually ended up doing AMC. It was a completely unexpected thing. The reason why I tell you this is mine is a bit of story, so that would connect to some of you as well. I won't take much of your time. Yeah, so that was around 2020 when I came to Australia just to visit my wife, and you all know what happened next in 2020, Jan or Feb. That's the COVID. I was in Melbourne. Melbourne, I'm not sure whether you all know or not. It had the worst lockdown measures across the whole world, wherever you can say. And they locked us out for 1 year. And at the time, they didn't give me permission to do the clinicals because New South Wales opened the centers, but they didn't allow cross border. So that's how I ended up decided giving up AMC, sorry, USMLE, coming into AMC. And yeah, obviously, if you're international students and if you're coming for the first time, I believe you all have a bit of visa issues, especially if you're coming on student visa or something like that, or if you're on a temporary visa, so which we had as well. Fortunately, we had applied for some useless masters. I did that, which is masters in business administration, public accounting, blah blah blah, which is just for the visa extension purpose. And after that, I did my exam in 2022 September. So the very first attempt, I studied for 4 months and then I did the exam. So fortunately, my USMLE experience has helped me. I did not take any course or anything like that. I was confident doing the exam, so I did the exam in September 2022, and I started teaching in November 2022, same time, like around. I got the results in October. I started teaching from November at Allen's, and it was completely unexpected. So one of my friend who used to be a student at Aringasas, she recommended me. Alan is very good. Just drop him an email. If they are looking for any tutors, they would give you an opportunity. Surprisingly, they gave me the very first time I emailed Alan and the course coordinator at that time, along with Kush. Fortunately, I don't know Kush at that time, but I know Alan's email. So I emailed him, look, Alan, I finished my AMC exam, blah, blah, blah. And then he referred me, look at this guy, he's interested in teaching. So try and see how he goes. And next time Kush contacted me, that's when I knew Kush. Um, so surprisingly, I was supposed to be teaching in December, but somehow one of the tutor canceled their class. Okay, so that's how I jumped in and I taught one of the class for the other tutor, and students liked the way the class went. And yeah, since then, after that, yeah, the rest is the future. You all know how it is. If you have attended my 6 weeks and 12 weeks classes, any of you, you will know. I teach since then. I've been teaching regularly for both 6 weeks and 12 weeks batches, and it's been continuing, and it will be keep continuing as well, as much as I can. Right. Coming to my background, so there was a 3 years of gap between. So 2019 was the last time I did the job as a medical practitioner, and after that, I had quite a bit of gap for around 2.5 years or more because, like I said, the COVID and stuff and everything. So yeah, I was a bit worried. Yeah, okay, so whether this gap is going to be continued and whether I'm going to get a job or not. It was like a complete dilemma scenario. So what I did is I spoke to one of the other GP and my senior from my college, who is also a GP trainee here. So they just recommended me, as soon as you finish your exam, just go and do recency of practice. So they recommended. So I thought initially doing 1 month. They told me, no, no, go for 3 months and then come back. It will boost your CV. Yeah, that's what. So they recommended. They have the seniors, so they know the stuff. I'm just fresh graduate. I don't know what I need to be doing. So I trusted them because I know them personally as well. And I went back to India and did 3 months of practice there and came back. As soon as my recency of practice is finished, while I was in the practice only, I got a job interview, surprisingly. And even before, without my recency of practice, I got the job interview, but I did not do it. I couldn't get through. There were three questions. In one question, I still remember the patient had a fall. I forgot to tell them that I'm going to do a CT brain. So that's still a nightmare for me. I told rest of the other thing, vasovagal syncope, cardiogenic, neurological issues, and all those things. But the only thing I didn't tell them is I'm going to do a CT brain because the patient is on anticoagulants. So after the interview, I realized, oh, why did I not tell this? Because it's a vital part. Because patients on anticoagulants who had a fall, you need to do a CT brain along with a head strike to rule out any intracranial bleed or something, because that will change your management completely. So I asked for the feedback. Like Dr. Karan said, it's always very important that we need to ask for feedback. So I just emailed the medical manager of medical services, and then she told me, you did very well in two questions, but unfortunately, you did not score 1 point in the third question, which is the CT brain. Okay, so I thought like, oh bugger. Then okay, that's fine. This is my first time. I'm just getting there, so it's okay. Then I did my recency of practice, and again for the next time, I emailed them. The next time they gave me another interview in February, but this time again I lost it with 1 mark again, same in the third set of question. I thought like, where am I lacking? So, but still I keep continuing applying for the jobs. And it's been more than 4 years. Still, I'm waiting responses from some of the hospitals, which I have never heard from them. Not even a courtesy email saying that you have been selected, your application has been received, blah, blah, blah. And every morning I used to get an email saying, thank you for your application. Unfortunately, due to the high demand of the job purposes, we couldn't process your application further. That I used to see it every day. And then at some point of time, I gave up. Okay, so this is not working at all. So then I did my recency of practice, and surprisingly, it was probably my luckiest day. I still remember those days because I never forget those days. I had a little bit of argument with my wife, and then she's in the bedroom. I was in the hall, and it was around 10 p.m. night. Okay, I just opened my lappy, and next day morning I have a class with the 6 weeks batch. That's a Saturday, Friday or something. And then I opened. I just Googled Seek, and then there was a job application which is next to like immediately 15 kilometers from my house place. Okay, I was like, this is something I need to apply. Then I applied. And I was teaching for the 6 weeks batch as usually. Next day morning around 10 o'clock, I got an email like, try and do an interview in 72 hours. So just imagine I applied at 10 p.m. midnight. Who is going to read my CV? No one. Early in the morning, probably they gave probably a brief glance. And as soon as they started around 8 to 9, and I got an email by 10, which is in 2 hours, saying do the interview in 3 hours. So the reason why I'm telling you is if it is your lucky day, doesn't matter whether you got a step one or doesn't matter whether you got a step two as well. If it is your lucky day, right time, right place, right job, you will get it. Okay. So, and then I did the interview, and then after the interview, I thought like, okay, so I did well. I'm gonna wait because usually after interview, probably within a week or 2 weeks, you get the response. I waited 1.5 months to get a response from them. And considering my anxiety, I even emailed the HR saying, oh, look, I have done my interview. I haven't got any response. Can you tell me when it's the response? Then she said, we'll get back to you when we have any information, as usual, the routine email. And then someday I was going somewhere, and then I got an email saying that your application has been processed. Ask your referees to do the referee check. And I still remember I called Alan right away and asking him, can you do a referee? And he did it surprisingly within the next half an hour to 1 hour. And as soon as I got the email at around 9 a.m., I finished my referee check by 4 p.m. the same day. The next day morning, they called me asking whether you want a 12-month contract or a 24-month contract. So this is how I ended up in the job, and with a 3 years of gap in experience. So most of the times people get a question asking, I got 1 year of gap, I got 2 years of gap, 3 years of gap. So the reason is the gap is not a big issue here. Whether you are able to meet the criteria for APRA CPD, which is the continued professional development. Okay. So I'll just briefly tell you what is a CPD. So if you do any courses, okay, or if you do, like, for example, if you're doing a 6 weeks course or 12 weeks course, or if you're doing ALS or BLS, or if you're doing an online learning, everything comes under the CPD, which is accredited by RSCGP or ACRM or emergency medicine or whatever. Or even if you do like attend an ultrasound course, that is also considered as a CPD. And on top of that, we have multiple websites where we can do a free ThinkGP is another website, which is a free CPDs as well. You can do there. And if you do 6 weeks course, you get 150 CPD hours. All you need is 60 hours of CPD for a year. And when you're meeting the recency of practice guideline, so as per APRA, so the recency of practice is something in the last 1 year, you should have worked for 4 weeks full-time job. Okay. So a full-time job is something considered in Australia if you have worked more than 76 hours. So anything 76 and above in a fortnight, that is considered your full-time job. Okay. So like that, in such cases, 2 full fortnights, you should be working for around 156 to 160 hours is your 1 year time frame if you have worked. Or in the last 3 years, you have worked for 3 months full time, which is 12 weeks full time. So either of the criteria, if you meet, that is your recency of practice. But if you haven't worked in the last 3 years, and if it is more than 3 years, then you need to show them the CPD hours, which is your training courses or attending any teaching courses or doing any seminars or attending any webinars or something like that. And as long as they provide you a CPD certificate, that should be considered as your continued professional development as well. Okay. So this is the most common question. So if you ask me, if I do 3 months in the last 3 years versus if I do 3 months in the or 1 to 3 months in the last 1 year, I would always say 1 to 3 months in the last year is usually considered, because your application will have a better advantage as compared to people who have 3 months of experience like 2 years ago, right? And when I started applying, I got my job as soon as I finished my step one. I didn't even do my clinicals at the time, and I got the job. Fortunately, yeah, it was purely luck, God's grace, or hard work, or whatever it might be. Everything, it was my day. I got the job, right? Still, we see people getting jobs with step one, but the thing is, either you should have a permanent residency or a citizenship here, or the other alternative is you have enrolled in any other observership program in Australia. This is something Australia has recently started, which is observership. So most of the hospitals in, I believe in Victoria, which is Melbourne, they are providing the observerships, unpaid observerships. They will make you work and then they will do that. Some of the other programs are also there, MI Prep, which is done by Monash Health. And some other hospitals are also opening that MI Prep program, which is a 3 month MIPREP, which is a 3 months program. Sometimes they have 4 weeks, sometimes they have 12 weeks, and I think you need to pay for that program. You will get a brief 3 months of registration from APRA. And so as far as I know, everyone who has entered into this MI Prep program, 99% people secured the job. And you should be either a permanent resident or a citizen to apply for MI Prep program. If you are an international medical graduate or if you're on temporary visa, you're not allowed to apply to that. That's guidelines, stuff like that. But still, you're allowed to apply for observerships. So worst case scenario, if you can't get an observership in a hospital, what people recommend or I recommend is, if you know any GP who is working here, who is fortunate enough, or if they're willing to help you, just go and ask them if you're happy to provide a letter for them. And if you observe them for 2 weeks or 3 weeks, something like that, that will also boost up your CV as well. Okay. Worst case scenario, if you can't get into a hospital for an observership. The other alternative, obviously, AMC2. So if you do AMC2, you don't have to worry about any of all those things. And you have, like I already said, 90 to 95% chance of securing a job. And as far as I know, people who have done AMC2, I haven't seen anyone who is sitting without a job. Okay. So that much confident I am to tell you that if you do AMC2, you have a job in your pocket, right? And when we talk about the pay grade wise, let's say if you're an RMO1 or RMO2 or RMO3 or Registrar 1, Registrar 2. So there are different pay grades. Each state has got a different pay scaling stuff. If you work in Melbourne, New South Wales, or other areas, probably you might start as RMO1, probably around 85 to 88K per year, which will be your pay. And on top of that, they will pay you a professional development allowance and some other basic allowances stuff. You will be definitely making 110, 120K, including overtime, weekends, public holidays, all those things. But that's the base pay, we say, right? And in regards to when we talk about other states, for example, Northern Territory, Western Australia, they usually pay you a little bit more than the Eastern states. In Western Australia, there is a 7 to 8 grand difference between Eastern states. Same like Northern Territory as well. If you are a registrar, like registrar one, probably you will be starting around 115 to 125. That's the base average pay. And again, obviously, like I said, every doctor who works in Australia, they get a professional development allowance. They pay anywhere between 5,000 to 6,000 for RMO and for intern and RMO, and going until 12,000 for a registrar. So that's what the professional development allowance, which will be paid in every fortnight into your pay cycles, right? Those are the few things that I wanted to tell you about. Yes, you need to do AMC1 doctor. Without AMC1, you won't be allowed into any observership programs. So that's the minimum criteria you need to meet. And some of the observership programs, they will also ask you whether you have done an ALS or BLS, stuff like that. So there will be some listed minimum criteria to be meeting in order to get into these things. Okay. Right, so that's all briefly about, and I believe you all know about AMC and how the structure of the exam. I'm not going to bore you with all those basic details. So we'll take hardly 1 to 2 minutes to finish them. So unit first is epic verification. Second thing is AMC ID. Third thing is book the exam. So once you book the exam is 150 questions. I believe you all know that. There's no negative marking in AMC, and you need to score 50% to pass the exam. And there are 6 subjects that you need to focus on, which is general medicine 30%, surgery 20%, pediatrics, obstetrics, gynecology, psychiatry, and population health. These 4 subjects will carry 12.5% each. Recently, I believe you all have received an email from APRA or AMC saying that the pass percentage has been slightly increased. That is mainly because, as you see, so many people are doing the exam. Okay. So when the number of people doing the exam increases, obviously they need to have certain criteria in order to pass. They can't make everyone who scores 50%. If they pass everyone, then obviously they have certain limitations on the number of doctors they need to pass as well. Okay. So let's say if there are 1,000 people who is doing the exam and they have only 30% to pass, and let's say there are more than 400 people who scored more than 50%, they can't pass all of them just because they scored more than 50%. Okay. So in such case, what they do, anyone who scored more than 51, 52, 53, they will pass the other upper higher target level candidates. And rest of them, even though if you have scored more than 50%, but you're not meeting the criteria, and that's why you see 249, 248. That's the scoring of your marks, which we often see. Most of the candidates fail by 1 mark, 2 mark, 3 marks, 4 marks, which is one terrible thing as well. Okay. Okay. I think you can unmute yourself and you can ask me, doctor. It's very difficult for me to look after all these messages. Feel free to talk. There's no limitations for you to talk. Yes, what questions do you have?
Yes, my question is, are we eligible to apply for observerships only if we passed AMC1
Yes.
without English tests, or English tests are essential as well?
Yes. English test is essential as well. OET or PTE, or I think those are the 2 things which we usually recommend, PTE or OET, occupational English test or PSN test, and you need to finish your AMC1. So if you do your OET or PTE, that will help you for your registration as well. You don't need to do anymore again the same exam. Most often they do OET, doctors or professionals, they do OET, which is easy. PTE is even easier. Before, when I did PTE, was very easy, but I think they slightly changed the standards for PTE as well, because nowadays most of people are passing the PTE, so they changed the standards. IELTS is also acceptable, but I don't see much of the people going for IELTS. But if you're someone, doesn't matter, in the APRA they will list the type of English exams they will accept. So in which PTE, IELTS, and OET, all of them are acceptable. So whichever you preferably feel right, you can do it. Should be fine. Okay.
Hi, Dr. Brahma. Can I ask you a question, please?
Yes, go ahead.
Okay, thank you so much. So basically the thing is that I cleared AMC1. I also cleared OET with grade B. And moreover, I have also experience of 10 years, like in emergency medicine as well as in psychiatry. But the problem is that I did observership in Australia as well in GP practice, like
Yep.
3 months respectively. But the thing is that I'm applying in a lot of hospitals, but even in the regional hospitals. But all the regional hospitals, even in the Queensland and Tasmania and everywhere, but all the regional hospitals are saying that they are connected to metropolitan hospitals, and mostly the email addresses are not right on the for IMGs. If you send them the email, mostly they get like they are not successful. They don't deliver, and mostly if they delivered the email address, they said that you have to apply from Seek or Indeed, but there is no hope. Like I'm applying from last 1 year. But there is no hope still. So I am very, very, very like hopeless
Just
now.
yeah,
So
don't be hopeless.
yeah.
Like I
So
already said, so I waited 7 months to get into my job, even 3 years before, right? And my senior, like I told you, who guided me to do this, he applied for 200 jobs before he got a job in one of the ED, right? So first of all, I would tell you, don't be hopeless. Yes, it is definitely stressful. If I were in your shoes, I would be stressful as well. So the worst case scenario, you think I got this much of year of experience. What is lacking? So probably you need to go back and revisit your CV. That is my first recommendation. And the second recommendation is don't put too much experience into your CV. If you're putting too much experience into your CV and if you're applying for a role of an RMO1 or RMO2, they usually think you're overqualified for the job. And also you need to see if you got like more than 3 years or 4 years of experience back in the country, the best case scenario, you should be applying for a registrar job. Okay. So if you got a psychiatry experience, like where you're a psychiatric trainee or just like worked in the psychiatry department?
I work as a psychiatry trainee.
Psychiatric trainee,
Like
right.
yeah, in my home country.
Yeah. So you have a very fair chances to get into psychiatry job, but I don't know where you're lacking. So where are you at the moment, in Melbourne or in other parts of the
Oh,
state?
right now I'm in Pakistan.
You're in Pakistan.
I
Okay.
was in Australia for last 1 year because my
Right.
family lives there, but
Did you
then
apply
I
for any
came back
central
here.
campaign? Did you apply for any central campaign?
Basically, in central campaign, the problem is that they ask for the registration number, and I don't have. Obviously, at the end of the details, they ask for the registration number, and moreover, they also ask that if you have a PR or visa sponsorship. So I don't have anything right at that moment.
Yeah.
So obviously, I said no, and then they emailed me that unfortunately you're not
Yeah.
successful.
Which campaign did you apply? Did you apply Western Australia campaign as well?
Yeah, I did.
But
Moreover,
I
I'm
know one
almost
candidate
mostly.
who got even he's in India. I know that candidate has got into selection into Western Australia campaign. He has got no PR, nothing at all, and he's still in India. Surprisingly, sometimes these things happen, which is very unfortunate.
Yeah. If they
That is
still
something.
ask, sorry, Dr. Brahma, to cut
Hmm?
you off, but
Yeah.
if they still ask you for the registration number, then you can leave the blank, right?
Yeah,
Like,
you can leave it blank because you don't have a
obviously,
registration number, right? So you can leave
exactly,
it blank.
exactly.
Yes, definitely. You
Okay,
can leave it
okay,
blank.
okay,
But the only
okay.
problem is, like I said, Dr. Wajiha, there are a little bit of over in terms of numbers of doctors that are currently working at a junior level. Still, they are struggling to get a specialist levels. So if you're someone who is a specialist who have your AMC, I would recommend, let's say you got a psychiatric trainee, you should start applying for a psychiatry registrar because there's a lot of demand for psychiatry registrar jobs here, or at least a psychiatry RMO for 3 months or 6 months and then step up as a registrar. So that would be my basic recommendation for you. And obviously AMC clinicals. If you're something that, and you need to go back and revisit your CV, that's the first thing. And the second thing is don't put too much of experience and start applying for an RMO job. So if you're 2, 3 years, 4 years, then that's fine for an RMO. But if you're like 10 years of experience, you're overqualified for an RMO job, make sure you apply for a registrar level jobs. Okay. Which will be just beneath the consultant levels. Okay.
Okay,
That's
thank you
what
so
my
much. Thank
recommendation
you.
will be. Because sometimes even my friend has faced the same issue. She got like 7 years, 8 years experience back in India. She started applying for RMO jobs. She never got any reply from anyone. So she's obviously overqualified for that level of jobs. Yeah. GP pathway is something you need to have. You can do AMC1 and then you can do FSP, which is Fellowship Support Program, RVTS, Rural Vocational Trainings. But that is something you need to do AMC1. And with AMC1, with limited registration, you can still enter into Fellowship Support Program. But the problem is at some point of time, you need to do AMC2 again. Otherwise, you won't get a general registration. So the standard recommendation will be, obviously, once you're done and dust with AMC 1 and 2, you don't have to worry about any more exams, and you can enter into whatever the training you prefer or you want to enter. Right?
Doctor, just a couple of questions.
Yeah.
So regarding the observership programs, like, do we have to pay for it, or
Observership
like
programs, I
the
don't think it's a paid, it's a free. You don't need to pay for observerships. But some states, they will still ask you to pay. But I think in Melbourne, most of the observerships are free, not paid. Unless it's a My Prep program where you have to pay $12,000 or something. I'm not sure about the price, but it is somewhere between 10 to 12 or something. Okay.
doctor? And regarding the ALS, BLS programs, doctor, so is it advisable that we should do it from our home country
Yeah, it should be
only,
fine.
or after?
Yeah, you should be fine. Once you get a job in here, you can come in, and obviously most of the hospitals run the ALS, BLS programs. BLS is mandatory. Most hospitals will ask you to do BLS every year as a part of your routine job requirements. Without BLS, you can't work. And ALS is something some of the hospitals run and affiliate with other institutions. And once you have your basic ALS, as long as it is recognized across the world, should be okay. Once you come in here, you can obviously upgrade your ALS too, and pediatric ALS, neonatal resuscitation programs, blah, blah. You can start upgrading, but baseline for an RMO level jobs would be ALS and BLS should be fine. Yeah.
Thank you, doctor.
Right, no worries. And yes, Dr.
Hi,
Shweta.
Dr. Brahma. Dr. Brahma, so I'm an anesthesiologist and critical care
Mm,
physician.
yeah,
Unfortunately, I also have a gap since 2024 because we moved to a new country, and I mean the license process here is in Riyadh is very tedious, so it took a
yeah,
while. I
yeah,
have finally secured a job, and I'm
yeah.
going to start this month. I just want to know, is there anything else? I mean, I obviously have ACLS, BLS. It's all renewed and done. I have CPD hours
Yeah,
in the last year,
sure.
CPD hours. So is there anything else I need?
No, as long as
Um,
you're starting your role as an anesthesiologist, you keep continue doing that. Only thing they need is in the
okay,
last 1 year whether you're employed or not. As long as you're
okay,
continuously employed, that should be fine, because in between the 2 years of gap, you can explain or justify while you're doing an APRA application. Because APRA is not something that they really take this gap into consideration. Like I said, they have certain guidelines. As long as you meet the criteria, you should be okay. But it is the hospitals. So if the hospitals are willing to offer you the job, APRA doesn't care.
okay,
APRA doesn't care at all.
okay,
As long as you meet
okay,
their criteria of recency of practice. Sometimes even more than 3 years of gap, I know even person who is like more than 5 years of gap without any recency of practice, the hospital gave the job, APRA gave the registration. But the
okay,
hospital will give
got
you
it.
a training plan. So that training plan will
Okay,
be for each and every single one of you. So depending upon your
okay,
level of your job requirements, and what's your experience and stuff like that, they'll make a common training plan. As long as you got the training plan that you submit to APRA, done. Only thing is you need to get the job. If you get the job, there's no issues with APRA.
so I will be applying for registrar if I'm not
Yes,
wrong, or
definitely
senior
you need to
registrar.
apply for registrar. Don't apply for an RMO. If you can't get into registrar job, try and apply, because you're a consultant level. If you
Yeah.
that means you're degrading yourself to the basic RMO level. So don't do that. Okay. Worst case scenario, you need to
Okay.
apply as a registrar, and then you can think about training and stuff.
Okay. And how do I get referees? So where I'm working, I ask just for
Yeah, you ask
recommendations
one
or their
referee
number.
from there. You ask one referee from Alan. That's what my recommendation will be. Because as you are
Okay.
doing a current course with Alan, and
Yeah.
one Australian referee would be better, and one referee from your baseline of where you're working, and a consultant level position
Right.
would be absolutely fine.
Unfortunately, I've not got a consultant level job here. It is,
Senior,
uh,
registrar, or whatever.
no, they have given me resident, but I'm hoping in a couple of months I can,
That's fine. We'll talk about it later, because we'll
Okay.
be in touch as well.
Thank you.
And I know another
Yes,
doctor
thank
by
you.
his name is Dr. Vijay. I will patch you up with him as well. He's an anesthesiologist back in India. He's 16 years of experience as a consultant level. I think he's planning for a senior medical officer or senior medical practitioner level jobs here. I'll patch you up with
Okay.
him, and if you got any questions, you can talk with him. Okay.
Perfect. Thank you so
Right.
much.
No
Thank you.
worries. Cheers. Okay.
Hi, Dr. Brahma. Do you
Yes,
want
Dr.
me to continue with the answers or questions on MCQs or in the chat box, or
Yeah.
or you want me to send them an email where they can ask everything, or you're comfortable? Anything else you'd like from
Yeah,
our
sure.
part for me to continue?
If you want to add anything, feel free to add, Kush. That's absolutely fine. No issues at all.
All right. So I wanted to ask you all as well if you've got any more couple of questions that you'd like to ask about the jobs and job applications and all, send us an email at admin@remixus.com.au. That's admin@remixus.com.au. I'll write it down here as well.
Ask a question, Brahma.
Yes, Dr. Bhagya.
Brahma, I am working in Kerala in a government service.
Mm.
I have more than 15 years of service. What's about this pesky pathway to a rural GP?
Pesky is good. It's a short form of AMC clinical. So if you're someone who is, because even if you're doing pesky means you need level 1 supervisor for you. So level 1 supervisors, finding a level 1 supervisor job, it's a bit difficult. But if you got clinicals, you should be good with everything.
But
But if you
Dr.
can't get
Bhag-
into clinicals, alternative is pesky.
Dr. Bhageshwari, still you'll have to do MCQs.
Yeah.
First thing,
Yeah.
would be
AMC,
MCQs.
pesky, and stuff.
After that, Dr. Brahma, she has to go through something in which they'll check her experience, and if it comes to equivalent to 3.5
That's while they are
years.
applying for the job, before they issue the registration, they will do a
Yeah.
comparable experience of
Yeah.
that in your country, and you need to provide all the documentations of
Yeah.
your experience.
Yeah.
And then don't think that they will compare all your 8 years of experience. They will probably
Yeah.
compare probably 3.5.
Yeah.
That's the maximum they do.
Yeah, and what happens is, Brahma, a lot of people, so this is what is quite trending with us, I'll tell you. They are coming to do courses with us. Someone or the other tells them, hey, I've got a clinical GP job for you. Come, I'll give you a GP job. They stop preparing for their clinical. I'm not worried about the course. They stop preparing for their own clinical preparation. They put that money on stake as well, and then they start preparing for GP. They do pesky. After that, the clinic has no clue. They can't get them registration, and they're not left with. This is a trend. Every group is following. One or two people are doing this, and then they're coming back to do clinical again. I would suggest Brahma's supervision one is I think it's really difficult, and because it's very hard for them to find GPs in M1.
And the problem is your pesky is only valid for one clinic.
Yeah.
If something happens with that clinic related stuff, again, you have to restart your pesky.
Yeah.
So if you're doing applying, let's say you didn't like the job, there's
Yeah.
not you can't do anything at all unless you sacrifice everything to continue, or if it is a workplace bully, or if you don't like the workplace, or your supervisor is not happy with you, or you're not happy with your supervisor. Anything happens or anything struggles you face, you need to stay in or you quit. In such case, you need to do another pesky if you're applying for another job. So if you do clinicals, there's no such kind of thing. You can do whatever you want.
The pesky, this is not a course, no, this is a comparison study.
No, pesky is a course. You need to do a semi-clinicals. It's just like that.
Okay.
Yeah, it's just a mini clinicals where you don't do full AMC clinical stuff, but you will do it as
pesky is three. One is RACGP, one is ACRM, one is IME. IME has been quite trending nowadays. RACGP has 50 cases, and pass rate is really low. ACRM is something that the candidates have been passing, and IME is something that was really trending nowadays as well. You have to go through an interview panel as well in IME. It's just like clinical as well, but be very careful.
Dr. Jasmine, I'm just coming back to your question. Can you be a little bit clear? What is this wards person, doctor? I'm not sure.
Wards person and an ward person during my second year away from.
Hello, doctor. Yes, actually, right now I'm a wards person who is practically the assistant of the nurse.
Okay, so AIN, assistance in nursing. Okay, cool. Yeah.
Yeah. So right now I'm working. This is my second year in Australia, and I get this job. And as my first approach to the Australian health system, and my question is that if I will get like any observation or any impact in my CV if I'm having.
I don't think so. Your job role doesn't impact your what you're doing, but it is considered as gap in experience. But obviously, you need to do CPD hours as well in the meantime. So if you're doing your Watts person or AI and job, keep doing that. But I would also recommend you need to be up to date on your CPD hours as well. That's another main important thing that you need to focus.
All right.
Okay.
Perfect.
Yeah. Yeah.
Thank you.
Like updating your ALS, updating your BLS, and doing some online teaching courses and stuff like that. That will improve your CPD hours, and that will keep you up in the pool as well.
I am doing some courses through the hospital because they share with us like an e-learning programs like
That different. That's not considered as your learning. E-learning product AINs is different from doctor's learnings, so that
all
won't be
right.
considered. No.
Okay, I need to do
Yeah.
some.
Because considering your role is not anything related to patient treatment. It's related to the patient care, so that's not considered as your learning.
Okay.
Yeah. Right.
Dr. Brahma, I want to ask a question.
Yeah.
I don't know if it would be exactly relevant. So I have experience of working at India, Bangalore, and I have 10 years of experience without AD gap. It's clear in my mind that I am looking forward for AMC, MCQ,
Yeah.
clinicals as well, irrespective of whatever happens, because I think that is the safest option after hearing
Yeah.
everything and across growing through any other people talking about it.
Wherever you go, that's the golden mantra.
Yeah.
Do
So,
AMC1, do AMC2, done, and you can do whatever you want.
yeah, so that was definitely my target. But one thing which I'm unable to find an answer is one is definitely because I have worked as GP and occupational health. I was looking forward to go on GP pathway. Second, because I had worked in occupation, I also wanted to do some course or some studies which are valuable in Australia. Like not like some random program, some random courses. Because
You mean for the CPD hours you're talking about, or
no, not CPD hours. CPD hours I understood, but something like which adds up as a course or as fellowship programs or
don't do any of those things, doctor. It's
doesn't
just
help. So
wasting
because
your
I
money.
hardly see here anything related to higher education or like higher degree, those stuff.
So most of the people used to do before masters in public health. That is wastage of some $60,000, $80,000. Completely useless. It's not going to build your CV, make your CV up. The worst case scenario, my strong recommendation will be finish your ALS, BLS, finish your AMC1, AMC2, get into the job, and then you upgrade yourself based upon the CPD hours and stuff like that after once you enter in here. Okay, so that is my standard recommendation. If you want to do any emergency medicine certificate courses and stuff like that, that can be applied after you coming in here. Once you start minimum working in the 6 months of the hospitals, that's when they will ask you to enroll in that stuff. Okay.
So like I came across some nutritional programs like in nutrition, again, which is not clinical relevant to doctor as such, but I did not find any other. I also sent mail to Monash to find for occupational health where I found that AMC1 is to be cleared to kind of apply for.
Yes, you need to clear your AMC1 if you're requiring for or asking for any job roles. And you can also do GP occupational health, very good pay. If you give a certificate for a patient for occupational clearance, you get $500 per certificate. So GP occupational health is very good as you got an experience back in there. Try and aim, or you can also be a simple occupational therapist as well. Yeah.
No, but not occupational therapist, like occupational
Yeah,
health.
GPOT, they do have GP occupational therapists. So you need clearance from them. For example, driving related stuff or anything related to work related injuries,
So,
certificates and stuff, follow-ups and everything will be done by the GP occupational therapist. So
oh,
occupational therapist is completely non-medical. GPOT is doctor who is doing an OT as well. Okay.
okay, I understood that occupational health is when you work inside the factory or a
Yeah, you do
workplace
have
and you do
that job.
assessment and all.
That's only factory related. So don't think like always OT is
It's
related to
different.
factories or industries related. You do
Okay.
have people having injuries related to other occupations as well. Because
Yeah.
factories are not the only other workplaces,
Yeah,
right?
like workplace
So
safety and
aged
other stuff.
care,
Okay.
any workplace related trauma or any workplace related injuries, that all comes under occupational therapist. So you
That's
see inside, offsite as well.
that's GPOT you said.
GPOT.
Okay,
Yeah.
I'll look for that then. Thank you.
Yeah. And
Hi,
you
Dr.
can also look
Brahma.
into the NSS website for the CPD
Can I,
hours.
so sorry, Dr. Brahma, there
Yeah,
are
yeah, sure.
questions about the website and they want to know about the CPDs and a few things. Can I just take 10 minutes?
Yeah, go for it. You go.
Yeah. All right, so I've not
Excuse
introduced
me,
myself. This
Dr.
is
Brahma.
Kush. I've been working with Alan, and this is from a remix house that you've received the link. So, if you've had any other questions that you'd like to talk to, you can talk to Alan straight away, who did his part as well in the beginning. So he's the director, a.roberts@remixhouse.com.au, who does act as a referee when you're applying for jobs. So I have been involved in doing the reference checks as well when Alan does it. And then for example, we run through thousands and thousands of doctors, and then he asks, how was Dr. Kush, or how was she like? So we do go through, and I tell him that she or he was enrolled with us in the 10 weeks. And if you go have a look, we do have suturing workshops that you do, or fracture management that you do. They really add skill onto you. So there are a lot of questions being asked about CPDs. We do have fracture management, women health, suturing workshop, ingrown toenail, ALS. These are really important for your CV. You should mention them. Those are RSCGP, APRA, so those are RSCGP, which gives you CPD hours and CPD points. Every triennium they change. So now it's the triennium 2025 and 2026. And if you would have workshops in these CPDs, these would cover your gaps as well. Do make sure if you're doing CPDs from Australia that they are clearly mentioned in your resumes. Do have your referees sorted as well when you're applying for jobs as well. So please make sure that you do mention your clinical observed and competent skills as well. And a lot of doctors, when they're applying, we've had few reference check for match as well happening if intern position match happen. And do make sure that you have an eye. You're not only applying on Seek and Indeed, you're applying widely. You're going across each and every website individually, having a look, applying there, showing your expression of interest. Ballarat, Bendigo, Frankston, La Trobe. These are the few of the hospitals, Gippsland, and then Gosford, really IMG friendly hospitals where you should be applying. And even for reg position, I just saw a question which said that should we be a fellow or something? No, anyone who's done their specialization back in their own country, they can apply for reg position. We get a lot of doctors who get employed after MCQs in reg position because they've had a lot of experience back in the country. So your CV is really important. Please have, if you've got Australian citizenship, please mention it there. If you've got working rights, please mention it in there. We do see CVs come across in which there are not even mentioned that I had working rights. Not really very sure about this, as long as the valid word was such as AHA Society should be good. Yeah. All right. Alan, do you want to add on something else to this, please? Dr. Brahma, do you want to come back?
Yes, I'm back.
Yeah. Thank you.
All right.
I think with gaps, Dr. Brahma, isn't it the CPDs that really help?
CPD is definitely helpful, but on top of that, clinical experience is definitely
Yeah,
more better
recency of
than
practice
CPD.
is important.
It's more important. And if you can't do any recency of practice, let's say you're from any other countries and you can't go back to that countries, unfortunately, and you can't secure, then CPD is the best other alternative. Let's say you're in Australia, it's better to do a CPDs in Australia. That's even better.
Any questions, anyone in regards to the MCQ prep, or EPIC or clinical? I think they've all got a lot of questions about job.
Yeah, so I believe I have answered all of your questions, guys. So there are some of the other candidates who are with us at the moment who has passed their AMC on the very first attempt and stuff like that, and who are currently in the role of securing a job. Dr. Vishal, do you mind telling something about the Rimgasas and how did you benefit and stuff like that? That would be great.
Yes, Dr. Brahma, thank you so much. And as Kush was telling, it's a more of a Dr. Brahma fanboy kind of thing. Yeah, my story. I'm an old graduate. In my first attempt, I got 246, but then after in 3 months, I gave my second attempt and I got 276 after that. And uh, the biggest, I think, the plus point was, yeah, I did the silence course, but like the high yield exam, 2 day discussions which you take. In my first attempt, I took only 41s, but like in my second attempt, even after though I was giving it after 3 months, I joined every month those sessions we discussed this, and yeah, and and as Dr. Sorry earlier, one doctor was saying, uh, I continued maintaining the relationship with the tutors, especially with Dr. Brahma, and I was very lucky to stay in touch with him. And I know he's very busy, but I used to even like, in the group or in the messages, send him messages if we had like some certain other issues. And
Yeah, it's all
yeah,
like a
this
team effort,
success,
and yeah,
yeah,
everyone is helpful, trying to get the best we can, especially if you're with
and another
the
thing I
first.
think, Dr. Brahma, which I haven't shared with you, only
Hmm.
yesterday I got my job offer letter as well after AMC1.
Excellent.
And
Very good to
yeah,
hear. Congratulations. A big congratulations. Yeah.
Amazing. Congratulations, Dr. Vishal.
thank you.
Yeah. I think you're on mute, Dr. Vishal.
Yeah. Okay. I thought, yeah, means this was my journey. And like, yes, because I have a work rights. So whatever Kush mentioned in the CV in the top end, I especially mentioned in that I have full working rights
Yeah, that's pretty
and
important.
I'm APRA eligible. Although I had a gap, but like I had uh, continuity of practice, which is the requirement. I did the CPD and also mentioned during the gaps. I continued doing the CPD courses, and I, especially because these 6 weeks courses, I did the ECG workshop, etc., which gives the CPDRs. So I mentioned these CPDRs. And yeah, another thing was like, yes, almost similar story, Dr. Brahma, because I was not aware. I applied the where I got this job. I applied earlier. I got the rejection. I went there to ask. There I met a physician and I asked, "Can I observe you?" Yeah, a little luck was on my side, to be honest. And the cardiologist agreed, not in the main hospital, but in a private hospital. Yes, you can come and observe me. And yeah, another 3 months, another 2 months after that, I again applied. Like there was a job of opening, maybe like I heard a couple of people moved it to another place. Like this is, I stay in Wollongong.
Hmm.
This is a Shell Harbour hospital, but maybe people move towards Sydney, especially Australian graduates. So position opened up, and yeah, I was lucky to get to be at the right point. Yeah,
Good big
Amazing.
congratulations for you, Dr. Vishal.
thank you, Doctor.
Very
Well,
glad to hear about
I
that.
think it really makes a difference when you give a personal touch because on paper you can't present the beauty of the nature that you have inside you. And until unless they don't see you or have a feel of working with you and they find that, oh, he's so easy going, such a nice person. And what else do they need, Dr. Vishal? You've been amazing. As yeah. So they were lucky they've got an asset like you.
Thank you, Kush. Thank you so much.
Yeah, and all the doctors are amazing like that. I mean, you're wonderful, amazing doctors back in. Oh, I don't love
Yeah.
so much Dr. Brahma.
Right. Any other questions for me, guys? Anything that you want to clarify or confirm with me?
Doctor, if we are holding a visitor visa,
Yeah,
so can
you're not
an
allowed to work.
observe, yeah, so observership can be done on a visitor's
Observership can
visa
be
as
done as
well.
long as you're observing and your role does not describe, because technically visitor's visa is something that you can't work.
Yeah.
And the role should specifically tell you that you haven't worked, you just observed and you're not getting paid at all. Okay, that's it.
Okay,
That should be very
okay,
important because
thank you.
sometimes many things might give you a big trouble. Big things might not give you any trouble at all. Okay.
Thank you, doctor.
That's a bit tricky. AMC clinicals, how to crack? Yes, contact Kush. try and do a course with us. Definitely it is helpful. Tutors are amazing, definitely. And the whole team is amazing. They will definitely help you and guide you throughout the process and pathway. Yeah, that's all I can tell you guys.
All right, I'll give you all the information, rest of the information, the selling
Yeah.
point now about
Right.
what are the
Yes. No
courses that
worries.
we provide. Okay.
Yeah.
Thank you,
Yeah.
Dr. Brahma. Pleasure to
No
have
worries.
you.
Excellent. All good, guys? Happy?
Thank
Any other questions for me? You all right? Yeah, and if you got any questions, feel free to text admin Harimdasas or what's that email?
Yes, Dr. Brahma does a recalls sort of a thing as well, where
Yeah, if you're
updated
interested,
sessions
then
every 3 months. He collects a lot of MCQs and then he makes sure that you are really up to date with MCQs, not only just doing the recalls, what are the
yeah.
topics behind it, how to prepare your MCQ really. If you have a friend, if you've got a relative, you've already passed your MCQ and you'd like someone to go ahead, so Dr. Brahma's the drill there.
Oh,
We've
thank
got
you.
him.
If I can
Yes.
just add this small thing, I'll just, this is a very honest thing. Like we were a group of 4 very close people who were studying together. We all were confused because in that month, his session was like just because before the exam week, it was there. And we were like really confused. Should we be attending this month? Because we have attended before that session. But glad, I think that was the best. And earlier Dr. Brahma was saying like your wish, Dr. Vishal. So then I just texted him, Dr. Brahma, honestly. So he said like he told me a couple of points, and I think that is the best decision we made. We joined that even the last month thing also. I'm not promoting. See, I'll not get any
Yeah.
financial benefit out of it. Please.
Yeah,
That's a
no one's
disclaimer.
doing anything.
No,
Yeah,
no.
but like because we and that all the important things were discussed. It's not only 150 MCQs he discusses. He discussed quickly all the important points, and especially where to find the right information. And all of us passed. And the score I said, like, being an old graduate, the scores we got was also very amazingly well, good score. And so we always discuss this. That was, I think, the best decision for us to. That's why I just wanted to come in and see.
Thank you. Pleasure, Dr. Vishal. I believe all of you who have attended, they know these
So,
things.
Dr. Brahma, from next time onwards, if someone asks you, should we do the course, don't say as you wish, say yes, do it. Just a day.
Because I give them a genuine opinion. I told him, look, Dr. Vishal, it's up to you. So you have attended multiple sessions. It's up to you. But if you want something, a quick recap, just join it. That's what I told him.
Yeah.
I gave him a genuine opinion. It's up to you completely. It's a $200 course, 2 days time. If you have time and if you want a quick recap, all of these things, just join.
Yeah.
That's what I told him, and he joined the next thing. The next thing I saw is all of the 4 people were there in our sessions, and then the next month they were examined and they passed it by God's grace. And yeah, so it is sometimes it's pure luck. Sometimes you fail by 1 mark, 2 marks, but don't get disappointed by those things. AMC is very harsh exam. Sometimes they don't really test your knowledge. To be honest, they need some tick boxes that they need to tick for you to pass. So you need to be very smart to pass the exam, whether it's a clinical or AMC step 1. You need to be smart. You don't need to be a super clinician for them. They need you to be a safe doctor who can practice in Australia and do things that is required to be done. Don't do things that they don't expect from you. So that's all they need to know. Whether it's a clinical exam or step 1 exam or specialist exam or a trainee level exam, every exam is the same. Because I work in a hospital, this is my 3rd year I'm working. I talk to registrars, I talk to consultants, and I'm a registrar myself as well. So we get all the information, because when we talk about our colleagues and senior doctors, we get to know, because all of them will be appearing for specialist exams and stuff like that. And once they keep talking, it's all about recourse. They study in groups, which is very, very, very important. No matter what the exam you do, study in groups. Groups is very, very, very important. Okay, because you need some support and motivation for you to pass the exams. And it's not like any other standard exams that we do. It's a bit of cranky exam, and everyone knows that. If you ask any clinician who is working in Australia, if you ask anything about the Australian exams, all they say is it's cranky exams, but they expect you certain little things. Like I said, the tick boxes, you need to tick them to pass. So okay, alrighty. Thank you, guys. I hope you all had a very good session. And thank you, Kush, for organizing this session.
Thank you, Dr. Brahma.
And
We'll
thank you,
try to
everyone,
do
for
this
being here.
every 2 months or every month.
Yeah, definitely. Pleasure. No issues.
Yeah,
And
to keep everyone up to date. Any
um,
campaigns that you have an idea and any clue recently happening? We had a Western Australia where there were a few openings, Keshav, and we had lots of applicants applying for there, and a lot of our doctors have been shortlisted. Out of nowhere, there was one of the doctors whose reference check came just a few days before, whereas the campaigns closed. I don't know how. So Western
that's
Australia.
probably because what happens is they do 3 levels of campaigns. So even though they finish the campaign, first level, they will send the referees first. And then once they're not selected in the first hospitals and they have been shortlisted for the candidates, they will get the second pool. The second pool, they go for the peripheral hospitals. Third pool, they go for the regional hospital. So that's why they get the emails first who have been selected in the first pool. And then, like, obviously, second and third pool, they keep going. Some people, sometimes, if there are jobs left over, but there is not enough people, what they do is whoever is next and selected in the interviews and stuff like that, they just send them some random email. If you're willing, just join in or attend an interview or just send your referees to check. So those kind of things, if you're lucky, you might get those things.
So what happened was, Brahman, they did all the reference check for I think 40 to 50. After they've been selected in the second one, after we've done the reference check and the videos, last year, they got a choice that these are the 1 to 20. Which one would you like to go 1 to 1 to 3? You have to choose like that. First
Yeah,
one.
now it's still the same. Still the
Yeah.
same criteria. One at the moment, even in Western Australia, the recent guy I told you about, he
Yeah.
had 3 options. That's what they're doing, like level
Yes.
1, 2, 3. That's the first level of finalization of the list. Second level, they have some peripheral hospitals. Third level, they have 3 different hospitals.
Yeah.
That's completely different as opposed to when I used to apply. When I
Yeah.
used to apply in the campaign, they asked me to usually select like different 10 of the hospitals, and then they asked me to put which one
Yeah.
would you prefer. But obviously, the second and the third, if they don't have a job in the first criteria, second
Yeah.
criteria, third. So they just push you if they don't have any selections. And obviously, Australian medical graduates comes first, followed by UK graduates or someone who is applying from UK. And the third thing will be someone who is an international medical graduate but currently living in Australia, no visa restriction. And the fourth person will be if you're applying from any other different countries of the world where you don't have an Australian visa. So that's the level of grading where they usually prioritize people. That's why we always say if you are someone with clinicals, you have a very, very fair and better chance at securing a job. And sometimes if you're lucky, like me and Dr. Vishal, even with step 1, you'll get a job. Okay. Right. All the best, everyone. And I wish you all had a good day. And thank you, everyone. And thank you for attending. Thank you, Kush. And thank you, Alan, as well. Tell my
Thank
regards
you,
to Alan.
Dr. Brahma, for
And
being
yeah,
on.
I wish you all the best. Thank you,
Thank
guys.
you.
Thank you.